Hello and welcome to ashford.com. You are watching an interesting video on what is tuberculosis, TB? How is tuberculosis spread? Please read this disclaimer carefully. According to a new study conducted by health economists at the University of East Anglia and the Centre for Diet and Activity Research in the UK, walking or cycling to work is better for people's mental health than driving. Some may see tuberculosis as a historical disease. Evidence of its presence can be found in the preserved spines of Egyptian mummies. An epidemic rampaged throughout Europe and North America during the 18th and 19th centuries, before the German microbiologist Robert Koch discovered the microbial causes of tuberculosis in 1882. The development of vaccines and effective drug treatment led to the belief that the disease was almost defeated, and the United Nations, at one point predicted that tuberculosis, TB, would be eliminated worldwide by 2025. However, in the mid-80s, TB cases began to rise once more in the US and worldwide, so much so that in 1993 the World Health Organization, WHO, declared that TB was a global emergency, the first time that a disease had been labeled as such. Fortunately, with proper treatment almost all cases of TB are curable. Cases of TB have decreased in the US since 1993, but the disease remains a concern. Without proper treatment, up to 2/3 of people ill with TB will die. Fast facts on tuberculosis. Here are some key points about tuberculosis. More detail and supporting information is in the main article. In 2012, 1.3 million people were believed to have died because of TB. TB predominantly affects the lungs, though it can also affect other organs such as the kidneys and heart. TB can either be active or latent, where no symptoms occur, and the condition cannot be passed on. Bacteria through the air spread TB from person to person. People with compromised immune systems are most at risk of developing active TB. Tobacco use has been found to increase the risk of developing active TB. TB bacteria can develop a resistance to antibiotics that fail to kill them completely. The most common diagnostic test for TB is a skin test. The majority of TB cases can be cured with antibiotic treatment. It'll that any courses of treatment given are fully complete. What is tuberculosis? TB is an infectious disease that usually affects the lungs. It is the second greatest killer due to a single infectious agent worldwide, and in 2012, 1.3 million people died from the disease, with 8.6 million falling ill. Doctor looking at X-ray. TB usually affects the lungs, although it can spread to other organs around the body. Doctors make a distinction between two kinds of TB infection, latent and active. In latent TB, the TB bacteria remain in the body in an inactive state. They cause no symptoms and are not contagious, but they can become active. In active TB, the bacteria do cause symptoms and can be transmitted to others. About 1/3 of the world's population is believed to have latent TB. There is a 10% chance of latent TB becoming active TB. But this risk is much higher in people who have compromised immune systems, that is, people living with HIV or malnutrition, or people who smoke. TB affects all age groups and all parts of the world. However, the disease mostly affects young adults, and people living in developing countries. In 2012, 80% of reported TB cases occurred in just 22 countries. What causes tuberculosis? The Mycobacterium tuberculosis bacterium causes TB. It is spread through the air from person to person, when people with TB affecting the lungs cough, sneeze, spit, laugh or talk. TB is contagious, but it is not easy to catch. The chances of catching TB from someone you live or work with are much higher than from a stranger. Most people with active TB who have received appropriate treatment for at least 2 weeks are no longer contagious. Since antibiotics began to be used to fight TB, some strains have become resistant to drugs. Multidrug-resistant TB, MDR-TB, arises when an antibiotic fails to kill all of the bacteria that it targets, with the surviving bacteria developing resistance to that antibiotic and often others at the same time. MDR-TB is treatable and curable only with the use of very specific anti-TB drugs, which are often limited or not readily available. In 2012, around 450,000 people developed MDR-TB. Who is at risk? People with compromised immune systems are most at risk of developing active TB. HIV suppresses the immune system, making it harder for the body to control TB bacteria. People who are infected with both HIV and TB are around 20 to 30% more likely to develop active TB than those who do not have HIV. Tobacco use has also been found to increase the risk of developing active TB. Over 20% of TB cases worldwide are related to smoking. Signs and symptoms of tuberculosis. While latent TB is symptomless, the symptoms of active TB include the following: coughing, sometimes with mucus or blood, chills, fatigue, fever, loss of weight, loss of appetite, night sweats. TB usually affects the lungs, but can also affect other parts of the body. When TB occurs outside of the lungs, the symptoms can vary accordingly. Without treatment, TB can spread to other parts of the body through the bloodstream. TB infecting the bones can lead to spinal pain and joint destruction. TB infecting the brain can cause meningitis. TB infecting the liver and kidneys can impair their waste filtration functions and lead to blood in the urine. TB infecting the heart can impair the heart's ability to pump blood, resulting in a condition called cardiac tamponade that can be fatal. Tests and diagnosis of tuberculosis. It is likely that a healthcare provider will use a stethoscope to listen to the lungs during breathing and check the lymph nodes for swelling. They will also ask about symptoms and medical history. Woman having injection. TB is most commonly diagnosed via a skin test involving an injection into the forearm. The most common diagnostic test for TB is a skin test where a small injection of PPD tuberculin, an extract of the TB bacterium, is made just below the inside forearm. The injection site should be checked after 2-3 days, and if a hard, red bump has swollen up, then it is likely that TB is present. Unfortunately, the skin test is not 100% accurate and has been known to give incorrect positive and negative readings. However, there are other tests that are available to diagnose TB. Blood tests, chest X-rays and sputum tests can all be used to test for the presence of TB bacteria, and may be used alongside a skin test. MDR-TB is more difficult to diagnose than regular TB. It is also difficult to diagnose regular TB in children. The majority of TB cases can be cured when the right medication is available and administered correctly. Antibiotics are prescribed, with the precise type and length of treatment depending on age, overall health, potential resistance to drugs, whether the TB is latent or active, and where in the body the infection is located. People with latent TB may need just one kind of TB antibiotics, whereas people with active TB, particularly MDR-TB, will often require a prescription of multiple drugs. Antibiotics are usually required to be taken for a relatively long time. The standard length of time for a course of TB antibiotics is about 6 months. All TB medication is toxic to the liver, and although side effects are uncommon, when they do occur, they can be quite serious. Potential side effects should be reported to a healthcare provider and include dark urine, fever, jaundice, loss of appetite, nausea and vomiting. It is important for any course of treatment to be completed fully, even if the TB symptoms have gone away. Any bacteria that have survived the treatment could become resistant to the medication that has been prescribed, and could lead to developing MDR-TB in the future. Directly observed therapy, can be recommended. It involves a healthcare worker administering the TB medication to ensure that the course of treatment is completed. Prevention. 11. Face mask. If you have active TB, a face mask can help lower the risk of the disease spreading to other people. A few general measures can be taken to limit the spread of active TB. Avoiding other people by not going to school or work, or sleeping in the same room as someone, will help to keep the germs from reaching anyone else. Wearing a mask, covering the mouth and ventilating rooms can also limit the spread of bacteria. In some countries, BCG injections are given to children in order to vaccinate them against TB. It is not recommended for general use in the US because it is not effective in adults, and it can adversely influence the results of skin testing diagnoses. The most important thing to do is to finish entire courses of medication when they are prescribed. MDR-TB bacteria are far deadlier than regular TB bacteria. Some cases of MDR-TB require extensive courses of chemotherapy, which can be expensive and cause severe adverse drug reactions in patients. References.